is just a huge honor today to be podcast interviewing Regina Cobb, who is the only you're the only dentist in the state of Arizona who's actually in the government.
Right.
And I only know one other dentist who was ever in the government, and that's when I went to Creighton University in Swanson Hall. I was on the 9th floor, and Paul Gosar was in the 8th floor.
Yes.
And now he's in Congress in D.C. But I'm so honored that you said you come by and talk, because this dental therapist issue is just always huge. In my 30 years, whenever hygienists wanted to pass a law to practice by themselves, the dentists went insane. So let's talk dental therapists.
Well, it's not necessarily the hygienists practicing by themselves. A dental therapist is a new practitioner, pretty much, that is proposed. And the one that was proposed in the state of Arizona, I mean, it's been all over. We've got it in Minnesota and Alaska. What year was it? In 2006 it passed in Alaska, 2005, 2006. I think Congressman Gosar was on the Council of Government Affairs of the American Dental Association at that time. And his chief of staff, Tom Van Flein, was one of the legal counsel for the American Dental Association. And that was the beginning of the dental health aid therapist. Now they're calling it a dental therapist. And it started in New Zealand. And
those Kiwis.
Yeah, it's clear back when, and then they brought it to the United States, and they said that they were going to keep it up in the Alaska, and it was going to be for the bush and for people that couldn't get in there, and we all knew that it was probably going to start coming down to the lower 48 states. Well, Pew and Kellogg got behind it, big money.
Pew is the Pew Research Center,
right?
Pew and Kellogg.
And they got behind it. And they've been pushing it ever since it was up in Alaska and trying to get it down in the lower 48. The American Dental Association has done a great job. They have what they call a SPA program, which is an outreach to help the states. And every time it came into one of the states, and the dentists were not for it in that state, they came in and helped them do promotional things and that kind of thing to help them with, getting the backing from the American Dental Association. So they've used the funds that you and I pay for licensing fees to help out with that. This is not the first time it's hit Arizona, but this is the first time they hit it with legislation and actually wanted to hit it strong and hard and try to see if they can get it passed in the state of Arizona. Why they think we're a target, I don't know. I think we have a very strong dental association here, and it would be very difficult to get it through. Obviously, we came out in strength. It came to the Committee of Reference, which is kind of the first step before they get legislation. What it is they put in a sunrise application. They have to go through the whole process if they're going to expand the scope of practice. And then they come in and they throw the idea out there. If it passes the Committee of Reference, which a lot of times the sunrise applications that come to the Committee of Reference have already done their homework. They've already done stakeholder meetings. They've already done all their homework. And then they come to the Committee of Reference, and we usually give it a yay if it sounds like it's something that can fly. It failed 8-1, which was awesome. So it was a big victory for us. Now, can they still come in with legislation now? Sure, they can. So we could still see Senator Kavanaugh, who they were kind of recruited for their bill. I could still see Senator Kavanaugh coming in possibly and bringing legislation. Hopefully not. Hopefully this squelched it, and it said how strong we are and how I'm going to fight this internally as well as the dentists are fighting it externally.
I've been a member of the American Dental Association since dental school, so 30 years plus. But I always find it interesting how people just look for one thing they don't agree with and they cancel their dues.
Yeah.
And I feel like that 7 out of 10 of us are paying for the work.
Right.
And whenever they badmouth the ADA, it's like, do they realize these are all dentists volunteering that instead of going home after work and watching ESPN like a normal person does?
Yeah, we don't do that.
Yeah, yes. They're down there volunteering, and then these people sit on the sidelines. So what would you say to any of my homies who aren't a member of the ADA because there's something they don't like?
Well, one of the strongest things, and we surveyed and found out from the dentists themselves, what is it that you want from the ADA? And the number one thing is advocacy. And that's what this is. This is working for you, making sure that you are still a busy person, you are the head of the team, that you are the one that controls how that team works. This person that comes in as dental health aid therapist does procedures that are irreversible procedures. They're procedures, surgical procedures. They can do extractions. And it says extraction of diseased teeth. Well, you and I know that if you have a large diseased tooth, a large cavity in there, and you call it a diseased tooth, and it's on number 15, and it could be a bear to get out. This is what they...
How long is their training?
3 years. 3 years post-high school. 3 years post-high school.
And
that's
a hygienist
clinical.
is 4 years.
A hygienist is 4 years.
So it's less than a hygienist.
It's less than a hygienist. And honestly, they left it so vague in their Sunrise application that it could have been 2 years for all we knew. But they were trying to say it was, when they were testifying, they were saying it was 3 years. And they were saying a hygienist could go to school for 4 years and be a hygienist, and she could do this, and then this could expand her scope. And I'm like, well, then why not be a dentist at that point? If you got 7 years of education in, you got 1 more year and you've got your dental education.
So 2 states have passed this, Minnesota and Alaska?
And Alaska. There's been a few other states that have had legislation to promote this. And actually, I think they've passed it, and I think it's Oregon and Washington. But it's not implemented yet. Now, CODA has created standards for this now, too.
And what is CODA for my homies?
The CODA is our regulation body that's separate from the ADA that regulates schools and regulates our and programs and testing. And so anytime they say it's CODA approved, it means that the school has gone through regulations to make sure that they're up to standards.
So they accredit the dental schools?
They accredit all the dental schools. And the programs that are in the dental schools, but this is not an accredited program yet. CODA has created standards, which kind of gives it a high five, like, oh yeah, we're going to go the next step. But they haven't done the actual accreditation yet. And so that was something they kept saying. It's in CODA accredited schools. It's that side of the fence has been trying to, pushing it.
And I thought I read somewhere that now other countries' dental schools are trying to get CODA approved.
Yes. Yes.
Is that a new thing?
Not necessarily. I think the countries have been trying to get CODA approved. They can get CODA approved.
Are many dental schools outside the United States CODA approved?
Not a lot, but there are a few. I think.
Would that mean if they moved to the United States, they wouldn't have to go through the 2-year foreign dental student
No,
program?
I think they still do have to do that, but
They still have to do that.
Yeah, I think it reduces the amount of time that they have to go through dental school, but some schools can't get CODA approved, so.
I imagine it'd be a great marketing for dental students.
It would, be in Puerto Rico, and
Yeah.
and I could I could get in dental school and be in an awesome place like that too.
So why are you personally mostly against dental therapists? Just that they're...
Protection of the patients. And the other thing that they put out there and said, this could be a marketing tool for dentists. You could have 4 dental therapists working for you, and you could be running that as many patients as you want to. So they were talking about volume, okay? And then also they kept mentioning volume in the rural areas and trying to get into areas that are underserved, and trying to do more children, and trying to do the poorer patients. These are our most vulnerable patients, poor children, and these are the ones that we're saying, okay, you can have substandard care, because you're poor or you're a child in a rural area. That if I had a choice between a dentist and a dental therapist, who would I choose to pull a tooth? Who would I choose to do a filling on? What if they have a pulpal exposure? What are they going to do? They're going to throw a filling in there, and then that patient's going to be in severe pain that night. Where are they going to go? So they're saying rural areas where there's not dentists. And in Minnesota, they have, I think it was 48 to 50 therapists there. one person testified as 7, another testified as 8 in rural areas. 4 of them are working for one guy, the one guy that came from Minnesota to testify.
When Arizona started their new dental school in Mesa, probably what was that, 10 years ago? 8 years ago?
Probably about a year, 10 years ago.
That was one of their big selling points, that they'd be sending dentists to more rural areas. Not Phoenix.
Actually,
and
AZDA was probably the first one that was under public health, and they've maintained that. They do send them out to rural areas, and they do make them do public health. And then Midwestern came in and right afterwards and kind of followed suit. They're probably not as much of a public health dental school as AZDA is, the one that's A.T. Still University. That one is more of a public health
now,
school.
Where were you born and raised?
I was born in San Diego, raised in Las Vegas, and went to high school in northern Nevada, in a rural area up in northern Nevada, Ely, Nevada.
For undergrad or dental school?
That was where I was raised at.
Okay.
Then as soon as I was 18 years old, I went to Colorado. Stayed there for 7 years. Did part of my undergraduate there. Had my first child. Then moved to Oregon. Finished up the rest of my undergraduate. Had my second child, and then decided I wanted to go further east than Denver, and I had never been further east. So I went to Cleveland for dental school. So went
with
to
2
Case Western
children.
Reserve with 2 children.
Married with 2 children?
I was married with 2 children. I had a 1-year-old and a 6-year-old when we started dental school. So
My gosh.
yeah.
Because the point I was making is you went to, you practiced in Kingman.
Yes.
How long you been in Kingman?
Almost 24 years.
24 years. So, how do you get, number one, why did you go rural? And how do you think dentistry could get more rural dentists?
We got to educate our dentists when they're coming out of dental school to do demographics. And that's what I did. And that was something that is not necessarily, everybody looks at, oh my gosh, where would I love to live? You know, and usually when you say that, everybody else is thinking the same thing. This is where I would love to live, you know. But what I did was probably the end of my junior year, I decided I was going to send away, and I knew I wanted to come back west. I just didn't know where. And so I did California, Northern California, not Southern California, but Oregon and Idaho, Nevada, you know, all the western states, New Mexico, Utah, and just checked out different areas and the population per capita, where the patients were per dentist, how the demographics were, mapped out where I kind of thought would be some great places to live, but had good demographics. And then I took a 3-week trip, and just went down. And if I hit a place and I liked it, I spent the night. If I didn't like it, I went on and checked out the next place, and just kept going like that, and all the way through. And I narrowed it down to Grand Junction, Colorado, which I had lived at before. There was a place in Eagle, there was a place in Grand Junction, and Kingman, Arizona. And Kingman had the best practice for the dollar value.
Oh, so you bought a practice?
I bought a practice.
Bought a practice.
Mm-hmm.
Yeah, you know, you never see 27 McDonald's on one corner.
No,
They're perfectly spread out.
Yes.
And I remember in the 2008 financial meltdown, Arizona had, I think, 86 dentists go bankrupt the year after in 2009. Almost every one of them was in North Scottsdale. How many went under in Kingman?
I would probably guess maybe 1, if that. He left and went back to did periodontics, so he went on to do a specialty, and I think he just had difficulty, but he was a new guy, and when he probably bought his practice too high, and ended up, you know, we did a huge dip at that point. So now you've got this big overhead, we're doing a huge dip. Everybody I think the population considers dentistry as a luxury. And so when that happens, when we got a huge dip like that, everybody's going to dip, especially us, because we're not on the top of the list of things that, you know, patients, unless they're in pain, they think, okay, now I can go to the dentist. But if I wanted to do these veneers, I'm not going to do them until I have the extra money to spend on that. You know,
so with
expendable income.
So you own your own practice. You have 2 kids. Where did you find the time, and why did you enter politics? Tell us when did you first know?
I always That's the question. Everybody says, where do you find the time to do this, and where do you find the time to do that? You hear people ask if you're going to get a committee member that's going to do the work, find somebody that's busy because they'll get the work done. Well, that's kind of me. I'm like a little ADD. I get out there and I probably sleep 4 to 6 hours a night, and I work like a dog, but I play hard too. So I think I have a good balance. Lately, not so much. More it's work than play, but normally I have a pretty good balance. But years ago, 24 years ago, when I moved to Arizona, I was probably a year after I joined the Dental Association, because I joined right away. Now you ask people to join in there, it's like, why would I join? What is it in for me? For me, it wasn't even a choice of why I joined. This is my profession and this is my job. This is what I do. This is part of what we do. And you got this profession. You are blessed enough to have that. You better be in there and you better be doing work for your profession. So 24 years ago, when I first became a dentist, Congressman Gosar came to me and said, I'd like you to join in the Northern Arizona leadership. Well, after I was in there a year or two, he said, okay, you have got to go on. My kids were little at that time. So I waited a few years, and then he kept bothering me. And then one year I just said, okay, I'm going to do it. So I went up as president of Northern Arizona, then, came in on councils, came in as a trustee for Northern Arizona, and then went up as Arizona's president in 2008-9. During that time, though, Paul decided he was going to go for Congress, and he called one day and said, "Gina, I'm going to do it."
What year was that?
I'm thinking it was like around 2006-07, like right in there.
Right before the crash.
Yeah, and he decided he wanted to run for Congress, and I said, "You are crazy." I said, "You do something at the state level first, or, be on your city council or run for mayor or something first. But why Congress? I mean, you're in an area that's very liberal, and you are very conservative."
He's in Flagstaff?
Yeah.
Flagstaff is liberal?
Oh, okay. Yeah.
Or would you say most college towns are more liberal than the big city?
Yeah, I would say so. And then the Navajo Nation, you got the Navajo Nation up there too, which is part of his district in District 1. So that whole area is more Democrat than Republican. And here he is, a very strong right Republican, trying to make it into this market. And I said, if you're going to do it, I'm going to help. So I would go in and campaign. I would help him with his fundraisers. I would do that kind of thing. And then we got redistricting. And redistricting came about after his first term. So he had Flagstaff, Prescott. He had a little place in Prescott because that's kind of a hub for Republicans, too, in that area. So he had a place in Prescott. He had his place in Flagstaff, and decided that when they redistrict, they took Flagstaff and Prescott and split them. And Prescott came into Mojave County also. So it came into District 4. And he said, if I ran in District 4, what do you think my chances are? I'm like, fantastic. I'd love to have you in my district. So when he came to District 4, we campaigned again
so
for him
he's
there.
not a congressman at Flagstaff then?
He's not connected to Flagstaff.
Not
It's
but
District
that's
1
where he
now,
lives,
but
though.
that's where it started at.
Yeah.
He has a place in Prescott too, so he
Yeah.
had to decide between the two. And in Congress, you really don't have to live in the community. 3 out of the 6 people that ran in District 1, which is Flagstaff, didn't even live anywhere close to Flagstaff. They weren't even in the district. You don't have to live in my district. In legislative districts, you have to live in your district. But in congressional ones,
did
you
your
don't.
interest start mostly in how the government affects dentistry?
Yes.
And when you say the ADA is mostly advocacy, does that mean mostly political laws?
Right.
So
right.
so it's mostly what would you
Things
call it?
that affect us every day.
Political, legal.
Yeah. So on a lot of on Obamacare, how it affects us every day. There are things that we fight at the federal level every day that affects us in our practices. One of those things is recently we fought and lost. It's implemented now, but one of the things was that you had to have a interpreter for 30 different languages in your office, and you had to supply it at your cost. Okay, so the ADA fought hard. That was one of the ones we lost, but we have won several other fights at the ADA at the federal level, and then we do now at the state level. Some of the things that we've passed in the last few years that I've been a big part of.
Couldn't you just flip them off and say it was sign language? Would that work?
Be fun?
I only speak sign language.
Sign language is one of the languages that they have in there. So the ADA, though, has checked into that. Once it was, we knew it was going to pass and that was going to happen. What they did was they checked into, there's an app that you can actually get, and within 10 minutes you can have an interpreter on your phone, on an app. And you pay for the interpreter when you need them. So that's how you can get around that. And you know, they've worked in that direction to try to help out the dentist. But at the state level, we passed teledentistry. We passed the expanded function dental assistant, which can do things that.
So you like the expanded duty?
I do.
You like the expanded duty?
I actually like it because the dentist is still part of the team.
An AFTA?
Mm-hmm. And it's just like the AFTA in some of the other states. They can pack and carve posterior fillings and anterior fillings. They can't do anything they can do anything that's reversible. Anything. I mean, they could put a stainless steel crown on for you. You know, they can do a temporary crown for you if you want a temporary crown done. There are some things that I think an expanded function dental assistant can be trained for. There's a program coming out now. Rules were just written over the summertime. So now they've got to get implemented into some of the community colleges, and then we'll start seeing some EFTA starting to come into the state.
Will it be the hygiene schools, the dental schools? Who do you think will train them?
Probably both. Probably both, yeah. I think that like Phoenix College will probably have one. Yeah. Ria Salata, who's been a big partner with the Arizona Dental Association, I'm sure is going to be doing an expanded.
Do you know how many states have EFTA now?
I would say probably half of them now.
And for our international viewers, will you explain what EFTA is?
EFTA is expanded function dental assistant. They usually have to go through extra training. They have to be certified as a dental assistant, then they have to go through an extra training to be able to do the reversible procedures, you know, like packing and carving amalgams and composites and you know, those kind of.
So we just went. Well, I think every presidential election that I've lived through. I mean, I'm 54, so I mean, it seems like every one of them is always 3 times bigger than the Super Bowl. and
this last one was huge.
So many of them have been so huge. Yeah. But one of the things that affects, they say never talk about religion, sex, violence, or politics, but one of the big...
Here we are, we're going to be talking about it all.
Well, the Affordable Health Care Act, known as Obamacare, affected dentistry because it mandated that when you sell health insurance to children under a certain age, that it had to include dental.
Yeah.
And a lot of people, I've seen numbers thrown around that an extra 8 to 10 million extra kids were covered by health insurance. But now Obamacare, so what's the status of Obamacare and how it affects dentistry? Some people on Dentaltown are saying that, you know, the Republicans are going to get rid of it. Other people are saying...
Yeah, Obamacare is gone. So let's just plan. It hasn't been repealed yet, but just plan on it. It's going away.
And you really feel confident about that?
Oh, yeah.
What percent?
I'm almost... Right now, I'm Vice Chair of Health. And I'm chair of Health and Welfare for the Appropriations Committee. And Paul's hoping, Congressman Gosar is hoping probably to be on the HHS, Health and Human Services Committee at the national level. So we communicate quite a bit with the national level and the state level. And I would say probably a good 95% chance that Obamacare is gone. Now, is it going to go away right away? No, probably not. We need to repeal it and replace it. There's got to be something there. Before Obamacare, which we had in the state of Arizona, we called it Medicaid expansion. And we expanded our Medicaid program to include all the things that were in Obamacare. So that's why we call it Medicaid expansion. That's going to go away also. Now that was a huge fight in the state of Arizona, expanding the Medicaid program. Last year I had another huge fight, which was kids care. And I sponsored that bill and sponsored the amendment, and actually had a difficult time getting it passed within the state, but I felt very strongly about passing that part of it. All that is probably going to go away. Okay, so now we have to create another system. We in Arizona are probably in a good position. For one thing, we have access. Okay, and we've had a successful program with access over the years.
Which is our Medicaid.
Which is our Medicaid. So our Medicaid program is one of the standards of care across the nation. So that's gonna help us. The problem is that we don't know how the money is gonna come from the federal level. Is it gonna be a block grant? Are they gonna give us money per capita? If it's a block grant, what they do is just give you a grant and the state chooses how they wanna appropriate that money out. Okay, and that's probably gonna be the case. What I'm hoping is they hold us harmless for a year, hopefully 2 years, to where we can kind of get into the new program and be able to start funding how we're going to do the healthcare program. Prior to that happening, though, we have to get some insurance reforms. And they're working on some insurance reforms at the federal level, and I'm going to be starting to work on some at the state level also. So at the federal level, since Paul went into office, prior to him being in office, he was on the Council of Government Affairs at the American Dental Association. He has been trying to get the repeal of the McCarran-Ferguson Act, which is the insurance is one of the only two industries that doesn't have to abide by antitrust laws like you and I do. So what they've done is they can communicate all they want, and you know how it comes back is the providers, the recipients of all their communications, and the person that is buying it, the consumer, is the one that has to pay the price for it. So if we can repeal the McCarran-Ferguson Act, they have to abide by antitrust laws. They can't communicate, they can't coerce, they can't do all those things that make price fixing happen. They're going to have to do competition now. Competition is good, and that's what we're working toward, is competition. ERISA reform, repealing of the McCarran-Ferguson Act. Those are two things at the federal level that have been out there for a long time that have not been able to get through during the Obama administration. So I think that those two things are going to go into place. That's going to increase competition with the insurance companies, and I think that's going to drive prices down. Now, what we're going to do at the state levels, and there's more than myself at the state of Arizona, we're going to try to do cross the state lines competition with insurance companies. So we're going to open up our borders to insurance competition. So
explain to, it was kind of confusing to me because healthcare, we have the federal program Medicare, which is for people over 65.
Right.
And then each state has a Medicaid. Right. For poor and disabled or what have you. Obamacare went after the expanding the Medicaid. If you already had a federal system Medicare, which my mom, which all the grandmas and grandpas on, if he wanted that, why didn't he just expand Medicare to everyone? Why did he? Because Medicaid
because you
was
have
so
to leave it at
complicated.
the state level on the certain funds that the state has. You have to leave that, the Medicaid funds, those have to be left at the state level. So each state has to choose what they want to do with those funds. Okay, so that's where the expansion end is. And they say that they wouldn't have had to use as many federal dollars. The states were going to expand. They could do what they wanted to do with their dollars. We are paying trillions and trillions of dollars for the Affordable Care Act, and so it really didn't save any dollars at the federal level. So we're looking at a failure of that system, and that system has failed because when you say the Affordable Care Act, it's not affordable.
Right.
When I was talking about kids care last year, I checked with families of 4 and said, how much does it cost you for health insurance? Let's say a $2,500 deductible. How much does it cost you per month? And it was over $2,000 per month for a family of 4 for health care. Now you talk about somebody that's making Let's say $48,000 a year, $4,000 a month, and now you're spending $2,000 on health care for your family. That doesn't leave a lot left over to live with. And that's where a lot of these families were. And that was where the kids care program came in. The Children's Health Insurance Plan, it left out that group. Obamacare did. It said if one person in the family is eligible for insurance, the rest of the family doesn't get any kind of subsidies. So you had subsidies for the poor, you had subsidies for people over that, but that group that is the working poor, the ones that are getting in there, didn't have any subsidies. So $2,000 a month is a lot of money for someone making $48,000 a year.
So what would you say to all the Bernie Sanders supporters who always were saying that the 20 richest countries, whether it be Canada, Australia, a lot of European countries, just have universal health care? Do you think that's something that will come to America in your lifetime, my lifetime? In what way is America so different than Canada, Germany, England?
I don't know how we're different. I just know we are different. I know that we think differently here. It's the United States of America, which means it comes from the states. And everything resides from the states. It doesn't start at the top down. It starts at the state level, and then the federal level has to abide by the states that are coming together. That's why you hear a lot of convention of states and national popular vote now is something because the states can get together and decide what they want to do. I think that's the difference. It's not starting from the top down. It's starting at the state level, and it's expanding out.
One more deal on Obamacare. What do you say to a lot of the people who say that Obamacare was really a Republican program, Mitt Romney Care of Massachusetts?
You know what? That system over there is not doing well either. And it could be that it was Mitt Romney Care, but I can tell you at a national level, it's failed. I just think it's a failure. I'm not happy with it. I haven't, like I said, I haven't seen it affordable for anybody. I think the middle class suffers with this program, and I think there's got to be a better way of doing it, and we've got to figure out that way.
Now let's switch gears to a whole different agency. The Environmental Protection Agency was in the news last week, implementing suggestions of amalgam separators, saying that the number one source of mercury showing up in the affluent or effluent water system, the water that drains back in, is from dental offices.
Now, we've been talking about amalgam separators for how many years now? And the better practice says that we probably should be putting amalgam separators in. So it's not like the dental community wasn't aware that this is something that's coming down the pike. We knew that it was. It was just a matter of time of when the EPA is actually going to put that into effect. I don't necessarily think that's the source of mercury. I think there's probably mercury everywhere. We just don't know where those sources come from. So they did as the most likely sources us taking out amalgams out of teeth. Honestly, I still take amalgams out of teeth, but I would say that probably at least 60%, 70% of my patients have totally composites now. They don't even have amalgam anymore.
Do you think amalgam will be banned someday? Do you think?
I don't know if it'll be banned. I think that it's outlived its life. I think that it's a good product. I still have amalgam in mine.
So do I.
So, I got
a true
how
story.
many times do you have a filling that's going to last you 25, 30 years? Your composites aren't going to last that long. But I think the public has asked for it, though.
I think it's funny because I was, when I was a freshman at Creighton in 1980, I went up to the dental school, and you had really low-cost dental care for undergraduate students at Creighton to dental school. So I went over there to take advantage of that. And I had 8 occlusals on my 8 molars.
Yeah.
So they did 8 occlusal amalgams. And then over that whole first semester, I lost all my hair.
Oh my gosh.
So I can prove that amalgam
that was the year.
causes hair loss. I got all my amalgams that first week, and by the end of the school year, I had no hair.
I had no hair. Had nothing to do with your stress level, Howard.
Yeah. So How do you? A lot of people are trying to wonder how do you juggle a dentist, children, politics?
It's difficult. I gotta tell you, the children are grown now. So my
How old are
daughters,
they?
yeah, my oldest one is 32, and my youngest one is 27. So my children are grown. I have two granddaughters, a 4-year-old and a 2-year-old, and but I have two practices, and one's in the north side of town, one's the south side of town. So I work those two practices 6-7 days a week when I'm home, so and then this year I said I felt like Gumby. I couldn't have been stretched any further without breaking, but I didn't have a doc. I had a doc in up until the end of session this year to help me out. And she was phenomenal, and I'm so thankful for having her the last few years. But she finished at the end of session, and then so I had to start working as a dentist, campaigned, and still do my legislative stuff. And I got to tell you,
So you don't have an associate now?
I do.
Okay.
I hired one about a month ago, and she just started with me, and she's working with me, and then I've got another one coming in part-time in the other office. So now I have two associates that are going to help me get through my session. But I would definitely love to have somebody that's coming in, that's permanent, that's going to buy into my practice.
When did you first get publicly elected?
I got publicly elected in 2015.
2015?
Yeah, it was my first year.
And do you see this as a hobby on the side, or do you see transitioning from dentistry?
I'll eventually transition. I think. I don't know if I'll transition permanently, but I love politics, and I always have. So this has been an outlet. 24 years of dentistry, and I love it still. I get up every morning and love to go to work. Love my patients, but this has always been kind of a little bit of a hobby on the side, because I was on the Council on Government Affairs for the American Dental Association until a month ago, and then I resigned because the campaigning was too difficult and spreading myself then, and then the meetings this year land during my session. So I'm not effective for you guys anymore, so I need somebody else to go into that spot. So politics at the American Dental Association has always been there, and I've always loved doing that. But it's almost like having two jobs, because when you go to school and you start at the beginning of the school year, you're like, oh, I'm so excited to go to school. And then towards the end of school year, oh, I can't wait till summer. Well, that's me going from one job to the other. I can't wait to start session now. I'm just so excited about starting session. About in April, I'm saying I am done. I'm done with you. I'm done with this. I want to get back to doing dentistry again. And I'm so excited to start dentistry again. So it just kind of revives my love for dentistry. And I think it gives me an outlet other than, it's completely different. It's not in dentistry. It's not like I'm going to say, okay, so this month I'm going to advance my skills, and I'm going to go to Panky, and I'm going to do all this, and this is my outlet. That's still dentistry. That's still in the dentistry box. This takes me completely out of dentistry and gives me a new outlet. And I love doing both of them.
So who's crazier, dentists or lawyers?
Lawyers, for sure.
Lawyers, for sure.
I sit next to a lawyer on the House floor, Eddie Farnsworth, and we've been told that we're the Costanzas because we have a love-hate relationship. I fight with him, oh my gosh, like crazy. But there's a few lawyers in the House, and those guys are just crazy. They are crazy. Now I can't say that dentists aren't. Here I am, doing.
Well, we always see Dentaltown as 250,000 dentists.
Yeah.
And we always say that you can't get two dentists to agree that today's Wednesday.
Yes, you're right.
But you think
can't get two lawyers to agree it's Wednesday.
I always thought it was interesting on the Supreme Court that they're all reading the same Constitution. They're all reading the same law.
Yes.
In my 54 years, it seems like all the major decisions are like 5-4.
Yes.
It's like
How do you not agree somewhere down the road? You know, and the same thing with legislators. It's like you have the really right and the really left, and they're never going to agree. And then you have the kind of right and kind of left. Those kind of come together and they mesh every once in a while. And
so back to my homies. What percent of them who don't pay their ADA dues do you think? What percent of what the legislative battles the ADA is fighting in 50 states and nationally, what percent of those fights do you think they're completely unaware of?
I think they're unaware of, especially the people that aren't ADA members. They're unaware of any of it. They just work their jobs and go to work every day and think somebody else is doing this for me. And somebody else is doing this for you. I'm doing this for you. You're doing this for me. People that are paying their dues are doing it for you. That is no different than us saying someone's on welfare and I'm paying for them to sit at home and do Nintendo. You know, that isn't any different.
It's a free ride.
Yeah, it's a free ride. It's a free ride. And that's not fair to anybody. They need to pay their dues. They need to give AdPAC dollars to help out, to keep people like myself in the state legislature, Denny Zent and up in the northwest area of the United States.
And then when they complain about what they don't like, it's like, well, I've heard you say worse things about your own mom and dad and two sisters and your Uncle Eddie.
Yeah.
But they're still your family.
They're still your family.
I mean, it's like, I don't think anybody at Thanksgiving dinner thinks they have a normal family. I think half of Americans think that, they're not related to at least half their uncles.
That.
I mean, I'm sure.
I come from an unconventional family. That's what everybody says. And I could say that about my family. And what I say is there are people that are out there working for you that you need to be assisting. If you're not out there and you don't have the time to do it, assist with your dollars. I mean, that really helps out.
Yeah.
And whether it be getting the ADA dues or donating to Paul Gosar, that is something that we need to be doing. I do both of those things. And I don't have a lot of expendable money, especially now, because I got to tell you, I take 4 months out of my job, 4 to 5 months. Last year was 5 months, 117 days during session. Take 5 months out of my year to be down at the legislature that I can't do dentistry at all. Then I probably spend 1 to 2 days a week doing legislative things. And I get $24,000 a year for that. You know what that pays for? That pays for my apartment down here. It doesn't pay for anything else. So this is a service back to the state. If somebody wants to provide their service, great. Let them provide it. Help them out with that. This year, I said, I went in front of the House of Delegates and they said, can we help you out with dollars? And I said, dollars would be great. What you could help me do is find me an associate, because at that point I didn't have one. And I said, I need somebody working in my office to keep it running while I'm doing this, because this is a service. And there's a lot of people that do provide those services. I'm not the only one. There's others out there too. And that's what we need to do. And being an ADA member, my gosh, you just wouldn't believe the things that we do every day that go towards dentistry. And our profession wouldn't be our profession if we didn't do it. If we let it go, we have 75% of the population of dentists is ADA members. We should be at 90%. If we had apathy, let's say like the American Medical Association, we would be down at 45 and 50%, and that's where they're at. And that's not what we want to do. So if you want it to go that direction, look at what they're dealing with in medicine now. And we could be doing that. We have fought that fight all the time to keep from going in that direction, to keep our autonomy, and to be able to say we are individuals and we want to stay that way. And we want to keep the private practice. We want the dentist at the helm of the practice. And then you can have a team underneath you, but still be the dentist at the head of the table.
And back to Boy Scouts, leave the playground better than you found it. I always thought, when I graduated, my mom and dad cried like babies.
Yeah.
So when you retire and you're not a member of the ADA and went to hell in a handbasket, you're not leaving the playground better than you found it.
You're not leaving it better.
You got to fight for your profession.
Yes. Yeah. And I want to determine people, fight for your profession.
But that's what I always want to ask you, because I grew up in a house where my two older sisters went straight into the nunnery. I went to Creighton because Mom thought it was the only approved Catholic university. And
I was raised in a Catholic family also.
Were you?
Yes.
So Paul must be Catholic too.
He is one of 11, and I'm one of 14 kids. So
are you serious? He's one of 11?
He's one of 11.
You're one of 14?
I'm one of 14.
God, I thought I had a big family of 7.
Yeah.
That's
we've populated the world between the three of us.
My mom must have been on birth control. And my brother was born when I was 17.
Nothing worked better for your mother than it did for my mother.
Yeah, that's what I call my little brother. He was born when I was 17. I call him, he was born with Vatican roulette birth control. But so I guess I do not have the stomach to argue religion or politics because I've been faced that whole life. I remember doing this last election so many times. You go to a dental meeting, you go to a restaurant, over in 5 minutes, just like, if anybody brings up this election, I'm leaving. I don't even want to talk about it.
Weren't you just up to here with
So
it?
where do you get the stomach for that fight?
You know what? I don't know where I get it from, but I do. It is just a passion. And once I get into it, it's almost like a drug for me. Once I start getting into it, I need more of it. I've got to continue with it. And I just feel just what you said, leave the playground better than you left it. When you walk away, that better be cleaner than you came into it. And with life, everything you do every day has to be thought of that way. My patients got to be better when they leave out of the office than they did when they walked in the door. That's your goal. That's your goal, is to leave life better than you came in. And I feel that passion every day. And I think this is my calling. This is something that I've come to. I didn't think I was going to be here years ago. I remember sitting as a delegate, an Arizona dental delegate, sitting in the audience, seeing the leadership up there going, wow, how do they do that? How great that they can. I'm just so excited for them, but how do they do it? And then the process just happened, and I ended up being in that spot and not thinking about how do they do it. Just do it. Just do it. Get it done. However you do it, your way is your way. And my way is probably not going to be for every one of your viewers. They're probably going to say she speaks her mind too much, or she talks too much, or whatever. It's probably not going to be the way for them, but it's the way for me, and it's the way I give back.
So when I was a freshman in dental school, the senior class had one woman. I assume her name was Token. Now it's half the profession.
Can you believe that?
Do you think?
And mine was kind of between you and now. So.
Do you think do you think dentistry is different now that it's half men, half women?
I do. I think the workforce is different. Okay, because when men came out, they were ready to work full time for the life until they were 65 years old and then retire, or 70 or 75 now. People are doing that all the time now. I think women tend to not be full-time workers. They tend to be more part-time workers. And I think you do have a lot of full-time people. I've always been full-time. So I've been one of those full-time workers. But I think it's changed the demographics of the profession as far as how many dentists do you really need? Are we going to go to group practices because someone's going to have a baby and she needs to take 6 months off, and so we're going to cover her while she's in her practice? I think it changed the demographics of how we're practicing. I don't think it changes the care we give to our patients. I think men care just as much as women do, and I think that part of it is the same. But I think it changes the demographics of how we work together and the types of practices we have these days, which I think is fantastic. I love that, 6 people can come into a practice and work together, and they can cover each other, and they all get their free time, whether it be a man and just wants free time or a woman needing 6 months for maternity leave. I think it's. Well,
I was glad you came on the show because it's such you're such a great role model for women dentists, and a lot of them. A very common question with young girls coming out of school is, I want to start a family. I want to have 2 kids, and I want to own my own practice, but they're not sure if they should do that at the same time. What advice would you tell her?
You can do it all. You can do it all. You just got to balance. It's a balancing act, and you've got to be able to balance that. I chose to have my kids and to take a year off after each daughter that I had, and have that full-time mom time with them. But once I started work and school and doing those things, I just included them in. I mean, there was times I had to take the kids with me to class. There was, they were sick, I would stay at home, and I would have somebody else take notes for me,
You sound just like my dad. Whenever my dad owned a restaurant. And whenever my mom would say, okay, now next Saturday, you're in charge of all the kids, I'd just say, yeah. Because he knew he was throwing up all the station wagon and taking us to the restaurant, and you were peeling potatoes. You were making onion rings, and you just had a bunch of low-cost labor that day.
I still do that with my grandbabies, too. And I have a 4-year-old, and she goes to the office with me. And I'll bring in a daycare person with me, but I'll go to the office. Then that's the other thing. Nowadays, you could have daycare in your office. I'm
not a politician, and I am not a lawyer or any of that stuff, but I always look back at those experiences that, those laws that you can't work if you're under 16. And I always think that is so bad and evil. Because all my friends whose dad owned their own business, we were in a business, we had role models, we were making money. But if your dad was an employee, the government do-gooder said, no, that's evil for you to go get a job at McDonald's or Burger King.
And you can see where they were trying to protect, but they limited. And it's just like Prop 206 right now that says the minimum wage is going to be this, this, and this. To me, that's wrong. Now you're telling your business person how to do their business. And if that didn't affect me as far as my employees. My employees all make above minimum wage, so it doesn't matter to me. But it does affect people that are kids coming out into high school that are 16 years old that want to get into into a medical field and want to just clean toilets and empty garbages in the afternoon, but they want to just be in that practice and kind of get some experience or scrub instruments and
you just get out of the house because your mom's at work.
Yes,
you're in a broken family, and the government thinks it's better to stay at home alone in an apartment, and because it would.
Do you remember the latchkey kids years ago? Years ago, they had the latchkey kids, and the kids were home alone. Because mom had to work, dad had to work, and so they came home.
And my buddy who used to, starting in the 7th grade, used to after school go to work with my dad, who paid us each a roll of nickels, is John Lease, who's now endodontist in L.A. And we thought at 3 o'clock, we were so happy because we had to go to work and eat cheeseburgers and excitement and customers and
people
girls
there.
working car hops and then when we come home, so many people said, "Oh, you shouldn't really work on a school night." We'd look at them like, "Dude, that's the funnest part of the week."
I love this.
I know. Yeah. Why would it be bad to work on a school night as opposed to what? Watching TV?
I know. I'm with you on all of that. I tell you what, some of the changes that we've made, I don't think are necessarily going to help the kids as they grow up. But my kids did that. I remember my dad was a contractor. And up until I was old enough that the guys started whistling at the job site, I was out there sweeping floors, sweeping up sawdust and nails, and cleaning up after my dad when he was doing his work. And he would take me to work with him. And that's summer, and the kids rotated depending on how old you were. And he would take us with him, and we would help out. That was part of your job.
And growing up in Kansas, all my friends that came from wheat farms, dairy farms, cattle farms,
they always worked. Yes.
They were milking cows at 5 o'clock in the morning, but if you tried to pass a law that let a 14-year-old kid get a job at McDonald's at 6:30 in the morning, they would think you were a child abuser.
Yeah. It's crazy. Yeah. It's crazy. No, that's not the world we grew up in.
Yeah.
And I still think kids need to work.
Yeah.
My daughter, even my oldest daughter, they had to give voluntary time in her high school. You had to give it. So I said, you have this much time that you're going to give for voluntary time. That's required of you. If you give above that, I will pay you $2 an hour for every hour you volunteer. Oh my gosh, my kids went crazy on that. They loved it. And the people at the hospital or wherever they were volunteering at loved it also. Now we got our little volunteers all the time, and I just think it gives them work ethics.
Yeah.
Then they go on and they become better employees for somebody
else.
And
they even say girls who do sports after school have far lower rates of pregnancy, drug addiction. Humans need to be busy.
Yeah, it is.
But you're so busy. I felt guilty of taking an hour of your time today. But I'm just, I'm so proud of you. I'm a huge fan of yours.
Thank you.
I don't know how you do it. I'm glad you do it. And I'm sure there's a lot of young women dentists out there and says, well, she can be a mom, own 2 offices, and be elected in the government. She probably doesn't have to work at Aspen the rest of her life. She could probably go start her own office, right?
Yes.
Yeah. If you can do all those, she can start her own office.
She can start her own office. You would just figure out how you do it. I remember thinking that when I was coming into dental school, oh my gosh, it's so much money. And just think of it as, it's dollars to help you get this direction quicker. And if this is really your dream and what you want to do, just do it. And just figure out a way of doing it.
Well, it's funny, the old adage, if you want to get something done, give it to the busiest person you know. And I knew there was no way you'd have time to do this interview. And sure enough, the woman with 2 offices, 2 kids, and elected official found the time to do this interview.
I ran back and forth to Phoenix. It's 3 hours for me to travel from my home to the Capitol. So the last 2 weeks, I've been 3 times. This is my first time this week. And taking next week off, going to stay at home with my grandbabies and going to have the week off. So yeah.
My grandbaby lives in Bullhead City.
Oh, really?
How about you, little Taylor Marie, and her little brother Gunner's still in the oven, but
so you got a new one coming.
Yeah.
Oh, aren't they the best?
They're actually, I say that my granddaughter was my reward for not killing all 4 of my boys.
I agree with you. I told my girls if I could have had these before you, I would have.
Yeah, exactly. But thank you so much for coming by.
Thank you for having me.
All right, thank you.